is Wellness Wednesday, and as you likely already know, in recent weeks, Utah has seen a surge in coronavirus cases. Because of that, Intermountain Healthcare is making some changes to their testing procedures. Dr. Anthony Wallen joins us today from Intermountain Healthcare to talk about the adaptations the hospital is making. Dr. Wallen, what is new with the testing protocol and testing sites?
Yeah, well, the first thing that patients will notice is that rather than calling a COVID hotline, they can go to our website and put in their symptoms or the reason for their test in the chat bot or the symptom checker, as we call it, and that will give them a test and an arrival window. The arrival window is a time that they would go to a curbside testing collection site so that they can more seamlessly get their collection of their tests done without having to wait long periods of time in their car.
And I know those wait times in the past, some people said they were very long. So this is certainly going to mitigate some of that wait time and make it really seamless and easy for people to go get tested. Speaking of testing, we've all seen video of that nose swab, and that looks like a deep sample that you're getting there, Dr. Wallen. You also now have saliva-based testing. Will patients have an option, or how is it determined if you're going to have the nose swab versus the saliva-based test?
Well, we actually default to the saliva because it's much more pleasant, as you can imagine. If somebody wants a nasopharyngeal swab, we certainly can do that. There are cases where we need to do a nasopharyngeal swab. For example, someone can't produce saliva for a medical reason. They may come to the site and they've had something in their mouth in the last 30 minutes and they don't want to wait 30 minutes to collect that saliva sample. So we may do a nasopharyngeal then. So, but most of the time we do saliva. We do ask that people not have anything in their mouth for at least 30 minutes or preferably an hour before they give us a saliva sample so that it doesn't cause any problems with the test at the laboratory. Small pieces of particles of food, of lipstick, chapstick, gum, all of those things can really cause havoc with our laboratory machines.
All right, good to know. I'm certain that patients will appreciate, though, the saliva-based testing that you're now offering. Dr. Wallen, what should people do while they're waiting for those test results?
Particularly if you have symptoms that you do isolate yourself. That way, until you know your test result or preferably until your symptoms are gone, you ought to be self-isolating from the public so that we don't transmit this virus to our community.
All right, so important to know. Dr. Wallen from Intermountain Healthcare. We do have that website that you can put in your symptoms and then also be directed to an appropriate testing site on our website. Go to fox13now.com and click on Wellness Wednesday. Dr. Wallen, thank you so much. Stay safe and be well.